Well, good morning, and thank you very much. In the interest of time, we'll try and speed this along. SpringHill does two kinds of investment. One is in the life sciences, which is kind of standard, boring stuff. Private cancer hospital, generic drugs company, biologics manufacturing, biosimilars, biobetters. Edge, this is the sheep monoclonal antibody technology company. So if you've recently had a thyroid test or a cardiac protein test somewhere in the hospital, it'll be one of our reagents. Sphere is a company based in Cambridge, using biosensors for online monitoring of anesthetic drugs whilst the patient is in the operating room. And then these are point of care diagnostics, really aiming for home use as well as clinic use for a whole variety of diseases. So that's sort of kind of boring venture capital stuff. The other half of our business is in social venture capital, where we're looking to maximize financial return, but also to look for a social and environmental return. And primarily, we're trying to ask the question, can we use enterprise approaches to solve and tackle social needs? And whilst we haven't directly invested in healthcare and health companies, because it's still, for me, quite challenging to try and see how we can reach the bottom of the pyramid through an enterprise model, apart from kind of building mid-tier type hospitals. The kind of businesses we invest in have mostly got health sort of components to them. So this is Hagar, which is an organization that rescues women and children from human trafficking. We've got more slavery today than during the time of Wilberforce, sadly. And we, at any one time, taking 600 to 800 women and children into our shelters. And one of the big challenges we have here is integrating the women back into employment. And we do that through enterprise. We have 4 businesses that employ about 600 people now in Cambodia and Vietnam. But the big challenge that we have here is mental health. 8-year-old girls, 10-year-old boys who've been sexually abused. The kind of need that they have is just indescribable. Women who have been held as captives for years. How do you help them? And so it's mixed funding. So we have an NGO arm through donors who come and help on that. And then once they're in employment, the businesses then have a pastoral care to keep helping these women to try and live some kind of a normal life. This is a safari game park in South Africa. Thankfully, it's malaria-free, so we don't have any malaria problems. We don't have dengue. And as I was saying to some of you yesterday, we see very little TB here as well. But our challenges here in the rural part of Africa is what? Alcohol abuse, substance abuse. These are silent diseases, and they come because people have a sense of hopelessness. So abuse is a big problem, and the big health problem here is HIV/AIDS. Officially 20%, we think it's more like 30%. And so again, it's a combination of NGOs helping on that front, as well as the business funding healthcare. And one of the deals I did with the government was, as the largest investment in that part of South Africa, I said that we want, because we are the largest taxpayer there and the largest contributor, we would like to see some kind of benefit for our people. And so we have a monthly mobile clinic that comes to the park and looks after the health care of our people. So that's part of the deal that we've done there. This is, for me now, one of the most serious problems that we have amongst the poor in Africa. This is what we call the 3-stone technology for cooking. 3 stones, wood, open fire, equivalent to 40 cigarettes a day. The impact on the health care of our women and our children is huge. And we need to try to address that. And one of the things we've done is to create a business down in Kenya, manufacturing a fuel-efficient cook stove. Still uses wood and charcoal, but uses 50% amount of the wood. And it's because my NASA scientist friends say, We know how to put man on the moon, but we can't build you a cook stove which is solar powered that size yet. Isn't that crazy, right? So we can't do that. So this has a direct impact on health, and we monitor that, and we think that that really is an important issue, apart from the fact of deforestation that's taking place. Sev, you mentioned mobile phones, absolutely right. This is a solar panel. This replaces the kerosene, again, a health impact on our women and our children in homes in rural parts of Africa. And so this replaces the kind of kerosene fumes that they breathe, but it also gives them the ability to charge their mobile phone. I take it with me when I travel around Africa, put it on your dashboard whilst you're driving, charge your mobile phone. You have a lamp that will last 8 hours, and it'll run your radio as well. So you can get BBC when you're traveling in Africa. So strong healthcare sort of impact. Bulembu is a town, an ex-asbestos mining town in Swaziland. Some crazy guys within the Transformational Business Network bought the whole town, 5,000 acres. And we have about 2,000 houses there. And our whole idea is to house them with house parents and AIDS orphans. Population of just under 900,000 in the whole country, but we have 150,000 AIDS orphans. It's the highest incidence of HIV/AIDS in the world. It's a country that can disappear because the mortality rate is higher than the birth rate. So huge problem. So how are we going to fund all this? Well, we're doing it through enterprise. So we're building businesses there to try and support all these homes. But it's not enough. Currently, we are 50% funded from enterprise, 50% from grants and donations. And I think this is probably the final example. This is an example yesterday I talked about the returnees. This is an Ethiopian guy who ended up in Stanford. Has now gone back to Ethiopia using a short code SMS type platform, launched a business that is doing exceedingly well, and this is part of going to be the platform for connecting up the hospitals and clinics and patients in the Cameroon, the healthcare system there. So, you know, these returnees have a really important role. I just want to finish on some you know, sort of big issues as far as I'm concerned. We all, being in the healthcare industry, have a vested interest to find new treatments, new vaccines, new drugs, and new diagnostics. But we are not so strong, I believe, in emphasizing prevention. My view is that the one thing that we can do to really shift and improve healthcare is not developing more drugs, it's not developing more diagnostics, it's providing clean water and clean sanitation. You know, with that, if we could just get this right, you know, a whole load of healthcare issues would just disappear. And so I just want to remind us, you and I have vested interest. We want to sell drugs, right? We want to sell diagnostics. We want to sell products. But, you know, the prevention side of getting clean water and just clean sanitation will just immediately change to healthcare. And the other issues, good housing. Again and again, we find that as soon as we improve housing, we find healthcare improves. So on the game park, our people now have flush toilets, indoor bathrooms, and solar panels, clean water. And you know, healthcare just improves. Okay, I'm going to skip that. And so I would talk more about neglected diseases of poverty, NDPs rather than neglected tropical diseases. And these are all mostly fixable, a lot of it fairly easy fixable through prevention rather than treatments. Thank you.